Hi, my name's John Nance. I'm the Product Development Manager for USA and Canada for Fusarium. I welcome you today to the University of Florida, North Florida Research and Education Center in Quincy, Florida, where Dr. Mathews Paret has graciously agreed to give us some brief talks about different watermelon diseases faced by growers in the eastern U.S. I'm going to step out of the frame and let Dr. Paret take over from here.
I'm Mathews Paret. I'm an Associate Professor of Plant Pathology at the University of Florida, North Florida Research and Education Center and the Plant Pathology Department. I'm based in Quincy, Florida. I graduated from the University of Hawaii in 2009. I started as a postdoctoral fellow here in 2009, became a faculty member as an assistant professor in 2010, and this is my 10th year here at the University of Florida. As we're talking about different diseases of watermelon, one of the first things we could look at is starting from early spring season. And one of the early aspects about a spring season is that we are looking at conditions that are cold when the transplants get into ground. But an important thing also to remember is that cold and wet conditions can be an issue for watermelon production from transplant stage onwards. If you were to think about cold and wet and conditions that conducive for certain pathogens, we need to first think about angular leaf spot of cucurbits. And in other words, it is also known as bacterial leaf spot of watermelon. And the pathogen in this particular case is a bacterium which are strains belonging to Pseudomonas syringae. Now, typically during February, March months when transplanting happens in North Florida, we are looking at early stages when it is extremely wet, and if there's any contamination of transplants either through seed contamination or at the transplant phase, we may see this pathogen in production systems. The best way to manage this disease right now is early application of copper at a medium or low rate, only because it can be risky at high rate for watermelon, and that would help to reduce potential infection and spread of angular leaf spot of watermelon. It is very important to also think about potential long-term impacts of that. Typically what happens is that once the temperature warms up, and if the season is going to be drier later, we can quit a typical copper program, because at that time, even if the pathogen is present in the system, it is really not conducive for the spread of the disease. The second important disease that you got to think about for watermelon in North Florida, South Georgia area would be Fusarium wilt. Fusarium wilt is caused by Fusarium oxysporum, former Specialis niveum. It is an important pathogen that is soil-borne. So how do you manage Fusarium wilt? Fusarium wilt, the race 3 of this pathogen, is extremely aggressive, and currently there's no effective methods to manage the disease. However, there are some methods that are coming up which do have great potential, and some is already being adopted by growers in this region. If you were to think about, one of the best ways to think about is start with clean planting material. In fact, one of the problems in the recent years we have been seeing is early transplant phase. During early planting phase, you see a lot of Fusarium wilt. So conditions when it is cold, it tends to be that the disease can manifest itself on the plants much more. But then slightly later planting, once the temperature warms up, the disease is not as much of a problem. So some of the data generated by some of my colleagues show that later planting compared to an early planting in North Florida is useful in reducing Fusarium wilt incidence and severity. The second, but a very important aspect to think about is field rotation. So typically if you have a field with a known history of Fusarium, you may want to think about avoiding that field for the next 5 years at least. And also an important thing to consider is that check and make sure all the transplants that you're bringing into your production is clean of any kind of symptoms that could be Fusarium, and if that happens, your field could be infested and it would be difficult to eradicate at that point of time. The third important aspect you got to think about is fumigant work very well. So if you were to use a fumigant like chloropicrin, some of the studies by my colleagues here as well as colleagues in Georgia show very clearly that use of chloropicrin is very effective in reducing Fusarium wilt incidence. So if you think about a holistic plan, clean transplants, clean field, good long-term crop rotation program, use of fumigants, and potentially there are some fungicides that could give some early reduction of the disease, even though it's not a long-term impact, but that can also be integrated into system. Now, if you were to think about another critical sustainable way to manage the disease would be to use grafted plants. Now, there are many type of approaches you could use here. You could have susceptible varieties grafted onto hybrid squash rootstocks, for example, and that is a good way to manage the disease. Studies by my colleagues here as well as other places clearly shows that if you were to use grafted plants, you can significantly reduce Fusarium wilt incidence and severity. However, one of the important considerations for grafting, at least in the US, is the cost of a grafted plant. If you're thinking about a typical seedless variety, you're talking about 25 to 30 to 35 cents per plant, while in a grafted situation, you're talking about $1 per plant. However, if your production system and the impact that grafted plant could make overwhelms the fact that you're spending more money on your initial investments, I think you have a good argument to go forward with use of grafted plants, at least in the US situation. However, if you think internationally in small-scale production systems throughout the world and with low labor charges available where grafted plants can be much more cheaper, it is certainly a sustainable way to manage the disease. The third important disease for watermelon is gummy stem blight. And gummy stem blight is present throughout the world, affects watermelon, cantaloupe, pumpkin, cucumber. Think about any cucurbits, but most importantly, it's a major problem on watermelon. Now, gummy stem blight can come from infected transplants, so it is important to check for the transplants again. And this is going to be a continuous theme everywhere clean transplants become very important. Now, the pathogen Staganosporopsis species is present widely throughout the world and can cause serious problems in early transplant stage itself. And if you are not careful in making sure that transplants are clean, you could get early infection. Systemic use of fungicides, starting with contact fungicides to begin with, followed by effective systemic fungicides, are very critical in effectively managing the disease. The other important thing also is that crop rotation in fields with major disease incidence history is still very important because the pathogen could still survive in plant debris in the soil systems. Now, management, when you think about with fungicides, irrespective whether it's gummy stem blight or other major fungal diseases or bacterial diseases, you need to think about using fungicides by rotating its mode of action. And the way you can think about it is something known as frac code. And the code and the use and the rotation of the frac code kind of gives an opportunity for producers to ensuring and limiting risk of fungicide resistance, thereby successful use and effective use of fungicides for gummy stem blight management can be instituted. Now, how do you identify gummy stem blight in the field? This is going to be extremely important because early scouting and detection is very important to plan appropriate fungicide spray programs. One of the ways that you could look at is to start looking at leaves. Some cases you need to start at early stages looking at young leaves, sometimes older leaves. Under the canopy would be better because that's where moisture would hold longer in production system. One of the ways you could start looking at it is to see whether you see oval or circular lesions. And if you see those lesions, it is potentially gummy stem blight. Now, what would be a better way to look at it? If you see those kind of symptoms, you could actually look at the leaves, typically flip the leaves. You could look at the leaf itself, you could also look at the petiole, you could also look at the stem, and you could try to see whether there are dark fruiting bodies, which are a classic way to look for gummy stem blight. I'm just going to do that right now. I just found a few fruiting bodies that would be very interesting for us to take to the lab to confirm whether it is gummy stem blight. The next major disease of watermelon is downy mildew. Downy mildew is caused by an oomycete, Peronospora cubensis, and it's an obligate parasite, which means it requires a host to survive on. During winter months in the US, typically you would have this pathogen survive in Homestead, Miami area, where winters are very mild. And you typically start to look at symptoms in a way that it would form these small bleach sections on the leaves. I cannot find the spores right now, and typically you would look at the underside of the leaf and try to see whether you could see the sporulation, which is very classic for downy mildew. Right now, I cannot see that sporulation, which kind of indicates that this might be a very early stage symptom of downy mildew. One of the most important ways to manage downy mildew is to look at crops that would be tolerant to the disease, but most importantly, continuous scouting of the field remains one of the best important ways to early detection and management of the disease. Fungicide options are very critical in managing the disease, but then you got to start with some contact fungicides that can reduce initial pressure, But moving on with systemic fungicides that are very specific to downy mildew would be an important choice that producers could make to effectively manage downy mildew. Another major disease of watermelon, which is getting more and more relevant for Florida and other places in the US, is powdery mildew. And powdery mildew typically starts on the underside of the leaves, typically on older leaves. And if you're in a field, if you're checking just the upper side of the leaves, you may not find it until it becomes too late. One of the important ways for scouting to look at is that while you look for symptoms on the upper side of the leaves, you should also look for underside of the leaves. And if you look underside of the leaves, you will find talcum-like appearance on the leaves, which is the reason by which this disease is known as powdery mildew. Now, the pathogen can move fast and long distances very easily. They produce spores that can travel long distances. They really like dry conditions, and it spreads very rapidly in dry conditions. The best way, obviously, to manage, other than clean transplant, good scouting practices, would be to think about using tolerant or resistant powdery mildew varieties as your first choice. Second and most important is to have protective fungicides that can give you a good handle of the crop early itself, and moving on to systemic fungicides that can effectively manage powdery mildew. There are many fungicides that works better against powdery mildew, and many of that can be found in the Florida Watermelon Spray Guide. And those choices can really help you to manage the disease very effectively in the southeastern US region. The next and the most important viral disease on watermelon that has been a major problem in the recent years towards late spring, summer, and for people who grow in the fall season has been cucurbit leaf crumble virus. This virus is a begoma virus and is vectored by silverleaf whitefly, and it is a huge problem for production for a late season crop. Now, this can be a major problem on watermelon, squash, and other cucurbits, but watermelon and squash seems to be the most affected. Now, what are the classic ways to look for leaf crumble disease? Now, if you look at this leaf right here, you can see yellowing of the leaf, but yellowing starts from the tip. The leaves tend to be much smaller in size compared to healthy plants, and you would also see the plants starting to completely curl inwards, and which is a classic way to look at. So you always have to look at all these multiple symptoms to think about whether this is leaf crumble disease. Now, you cannot tell this in a field absolutely unless you're experienced looking at it, but then you could take it to a lab and use a molecular assay to confirm the presence of the virus, and that would be the only way to tell this disease is leaf crumble disease. Now, an important thing to also realize is that a lot of the times this disease and the virus associated with can be found together with other viruses. So instead of single infection from one virus, which is the leaf crumble virus, you may also find plants that would have multiple infections from cucurbit yellow stunting disorder virus, squash bean yellowing virus, which are also problems for Florida production. Today I talked about some of the major bacterial, fungal, and viral diseases of watermelon that's affecting Florida producers. Now, it's important to realize that these are not just the major ones. There are many other bacterial, fungal, and viral diseases that affects watermelon throughout the world, and it is important to realize that management practices can change from one region to another depending upon local aspects, strain and isolate unique populations that may be present throughout the world. So you need to consider all of that aspects while preparing a management plan. A lot of options are available, including clean seed, clean transplant, good field soil, good early protectant for management practices, and systemic fungicides when needed. Now, in addition, there are many other tools, including grafted plants, resistant varieties or tolerant varieties, as well as use of weather-based models which can be used to tailor your spray program. Now, there is no one shot, one management practice for each of these diseases. You have to rely on an integrated pest management strategy that could be very effective if done appropriately anywhere in the world. Good luck managing watermelon diseases anywhere in the world. If you have a problem, find a plant pathologist right next to you. Good luck.